to a Royal College of Nursing Research Institute study that's hoping to improve the postnatal care for mothers with premature babies. Research coordinator for the Poppy project is Jo Brett. Jo, first of all, tell me, how did this project come about and what form has it taken?
Well, it started in 2002 when we had conversations with the Warwickshire Parent Support Group on their experiences of having a premature baby. And from there we started to collaborate with the National Childbirth Trust and Bliss, the premature baby charity, to look at parents' experiences of having a premature baby, but also looking at their information needs and their communication needs and their support needs after they've gone home as well. The first phase was a systematic review of the literature that's already out there. The second phase was a questionnaire that went out to neonatal units, asking them what services they currently offer parents. The third phase is interviews with parents, both fathers and mothers, finding out what their experience was and what was the, what communication did they need, what information did they need, what was the best support for them. And then the fourth phase will be a dissemination phase, which will be workshops with health professionals to teach them about the outcomes of the studies, and having talks with the neonatal networks and the child health services.
According to NHS maternity statistics, 50,000 babies are born premature in the UK every year and is defined as births before 37 weeks. During what can be a traumatic time for both parents and the health of the baby, quality postnatal care during the first few days and weeks is vital.
There's a lot of inconsistencies, whereas particularly some of the bigger units, obviously they have more funding and so they offer more of the services, they give more support to the parents. Some of the smaller units, they don't have areas where parents can go, they don't have support groups, they don't have the kind of things like the discharge planning. Discharge planning is vital when parents go home, that they have an educational programme to ensure that they know how to look after that baby when they go home. What happens is, if they're in hospital for a period of time, then they've dropped out of the system, where if you have a healthy baby, you go home, you have a health visitor or a midwife visiting you for a couple of weeks after the baby has been born. But if you've been in hospital for a while, then you've missed that. So quite often these parents go home and they have no support, they have no visits from the health visitors. If possible, it's nice to have a specialised health visitor, a health visitor that is specialised with premature babies.
New mum Jo Simmons had Nathan 4 weeks early and has received good support from the team at Warwick Hospital's Special Care Baby Unit.
Everybody's been absolutely fantastic. Really encouraging, even when you think you're making no progress at all. They're like, but encouraging, yes it is, there's little steps to look for, and it is positive. They've explained what's going on, what's happening, showed me how to do things so that you're still involved with his care and included in all the decision making that's going on. And friendly as well, making you feel relaxed and at home. And he was 5'7". Went really quickly, and I couldn't even believe he was there. It was so quick. I knew nothing about labour because my antenatal classes started the next day, so I hadn't been to any antenatal classes. I got there, they said, have you got a birth plan? No. Do you know about this? No. Do you know about breathing? No. I said, just explain as we go along, it'll be fine. And even when they said, well, do you want him on you? I'm like, yeah, I didn't believe, but he was there.
Nicola Jones's son Charlie was also premature, and her experience has led her to set up a support group for parents.
I think there are ways in which we could recognise parents of premature babies to help them with the experience of having this baby in such strange and complicated circumstances. One doesn't have a dedicated person to talk to when one's baby is on a neonatal unit, or at least I didn't, and many mothers don't. Practices vary. I had a different nurse look after Charlie every day, so there's a challenge there for them to know what's going on with the baby, and for them then to translate that to the parents and keep the parents involved. The other obvious gap is that one has left maternity services, you've had your baby, but you don't have a baby, so you don't have a health visitor. I think the Poppy Project is immensely exciting and hopefully will offer us a real opportunity to bring academic substance about how parents and babies bond and after a premature experience. Here is a properly conducted qualitative survey. That is extremely exciting, and as a parent who's for the last 8 years, and Charlie is now 8, been talking about this, it gives me real hope and a real sense that things may change.
For neonatal nurse Carol M., her experiences of working in postnatal care have changed over the years.
The postnatal wards now don't have the nursery nurses that they used to do, that mothers go home often because of the staffing, having not bathed the baby, being shown how to bath the baby, help with breastfeeding, which is a very emotive subject, general information that new mothers just don't have, and they just don't have the time quite often on the other wards.
Do you think the results of the project will provide better postnatal care for mothers of premature babies?
Yes, definitely. I think if it's taken on board, it will definitely help.
Feedback is always good, and positive feedback's even better. If the research shows where there's a lack of support and where there's an increase in support, then that's good for everybody.
If we look at what happened to full-term maternity care in the last 20 years, where we went from a position of mothers not necessarily being recognised and their needs not being recognised, to the immense changes that have happened now, there is reason to think that things can change for parents of premature babies too. And Warwick University, I hope, is going to be at the heart of the sort of changes that can be achieved.